Is newborn screening feasible for DMD and LGMD? This is a hot topic as well. And right now, maybe it's not ready for prime time. We had a wonderful speaker who summarized what the main issues are and criteria are for disorders where newborn screening is undertaken. So one is, for instance, there has to be a cost-effective therapy. So do we know that this single therapy is cost-effective? Can we readily identify patients with a cost-effective screen? So for instance, for DMD, maybe the screen is creatine kinase. And very high levels of creatine kinase can be seen in DMD, but they can be seen in LGMDs as well. So can we be very specific? And if we identify a baby who has a very high CK, then how obligated are we with a screening test to go forward and do sequencing or additional testing to be able to specifically identify the disorder that the patient has? We have to know that by pre-symptomatic treatment that the outcomes are beneficial or efficacious. And it was unclear whether or not we actually have that information or that data available yet for LGMDs or for Duchenne dystrophy.
Newborn screening has a distinguished history of diagnosing infants with very severe diseases early on when interventions are possible, when hours matter. And so some of the earliest newborn screening assays were approved for diseases where a few hours could make a difference in terms of outcome. What we're seeing now with some of the other genetic disorders, most states in the United States now do standard newborn screening for spinal muscular atrophy. And we are actively considering as both at individual state levels and on a national level, whether to do newborn screening for Duchenne muscular dystrophy. The time scale is changed, but it's no less important. So it may not be that hours matter quite so much in terms of identification, but we do want to identify these patients early. And why do we want to do this? The reason we want to identify patients early, even if they may not show symptoms for years, is that we really don't know what's the optimal time point to intervene. As more gene therapies come online, do we wait until patients are symptomatic to administer gene therapy, or will they do better if they receive the gene therapy before they're symptomatic? And so newborn screening will help immensely in terms of first answering these questions, and then once we determine what the best time point is, we'll be able to intervene. I personally suspect that it's better to intervene before the patients become symptomatic, but we need to have more evidence for that before we standardize that approach. So newborn screening will be a critical part of optimizing both gene therapies and other types of molecular therapies.
So for neuromuscular diseases like spinal muscular atrophy and Pompe disease, newborn screening has played an important role in allowing really early treatment to hopefully ameliorate outcomes, particularly in the most severe of cases. It has not been without challenges though, and in SMA in particular, some cases could be missed on newborn screening. And newborns also have variable outcomes in spite of the early treatment that newborn screening allows. And then for Pompe disease, newborn screening has allowed for identification of infantile onset Pompe disease cases that require really urgent treatment, but also has resulted in identification of this large cohort of children with later onset Pompe disease for whom optimal timing of initiating therapy is not really clear. Duchenne Muscular Dystrophy was nominated for RUSP, or Recommended Uniform Screening Panel, which is a list of disorders that the Department of Health and Human Services recommends for states to screen as part of their universal newborn screening programs. But an advisory committee pretty recently in February 2023 voted not to push Duchenne forward for additional review at this time. And it was believed that additional evidence needed includes evidence that availability of a disease-modifying therapy has clear benefit when administered to infants versus older symptomatically diagnosed children.